Hi, my name is Sadie Watkins, and I'm here to present to you Be Sure to Insure. And this is based off statistics of the Kids Count book for 2017. We're going to talk a little bit about insurance and some ways that Oklahoma has gotten better, but how they can continue to improve. In Oklahoma in healthcare, Oklahoma was ranked 46th in 2010, 34th in 2016, and was ranked 29th in 2017. So as you can see, we are continuing to improve, but there is still room for improvement because 29 out of 50, there are some places that we can go up. One factor that is affecting Oklahoma is the low birth weight. It improved this factor from 8.4 down to 7.9%. So from about 2011 to 2015, it's cut about 0.5%. And the year-to-year average is still failed to fall below 4,000. And smoking cigarettes is one of the leading causes for this low birth weight. Lowering the number of low birth weights, ways that we can do that is raising the cigarette fee by $1.50 and supporting smoking prevention programs and groups, providing nutritional programs in school and for expecting mothers to encourage healthy eating habits and choices. And we can also lessen the burden of food costs, and especially in some of the low access and food desert areas, which are going to be some of the poverty areas. No health insurance. Children without health insurance has lowered from 10% to 7%. It still remains higher than the national average though, which is at 5%. Those without insurance are less likely to have a primary care physician, and they're also less likely to receive preventative health care. Regular doctor visits become a burden for the low-income families. 21% of American Indian children are uninsured, and 7% of Latino children are uninsured. How we should encourage health insurance by making it more affordable and more accessible to those in low-income areas. Some examples that we have are like Sooner Care and things like that. They do offer that, but we need to reevaluate the fair income brackets for those who are going to qualify for those services. We also need a mandate that they pay for all the expenses instead of just some of them, and we also need to make sure that this is a fully funded program and that the state is supporting it. Child and teen death rate. The death rate of children between ages 1 through 19 is about 36 out of 100,000. The death rate includes physical and mental health, lack of adult supervision, and environmental exposure. This includes suicide, vehicle accidents, healthcare issues, and also includes neglect. Vehicle accidents are the leading cause at 34%. Next, we have suicide at 13%, and then homicide right after that. Decreasing the death rate, 36 out of 100,000 seems low, but we can continue to make these numbers lower. One, vehicle accidents, we could lower this number by stricter enforcement of road laws, preventing DUIs and speeding and things like that. Suicide, we need to prevent bullying in schools and offer more services to help those considering suicide. And uninsured children are those that are going without the medical assistance that could aid them in these situations. Drug and alcohol abuse, it decreased from 7 to 4%. The age range is from 12 to 17, and Asian teens are the least likely to have dependency problems. Abuse of alcohol or drugs during teen years causes a disconnect with the community and can impact the likelihood of unemployment and poverty. Negative impact on the brain during important cognitive development, and it's also the likelihood of engaging in unsafe sexual practices, DUIs, abuse of substances, and so on. To discourage the abuse of this, we need to offer them early work experience, also offer job readiness skill training for future success. We can inform children the impact of drugs and alcohol on unemployment and living in poverty because not many students want that for their future. We can also present counseling to those that are struggling with these addictive behaviors. We also need to provide them with the statistics for DUIs, crime, and substance abuse. Why we should insure our children. Leaving our children without health insurance leaves them without excellent care or regular hospital visits. It's reducing the care for our children, and it's also allowing them to be naive to the changes that they're going through. Regular care can increase openness to doctors and assistants outside the hospital, such as counseling or psych evaluations, and maintaining the health of our children is what's going to maintain the health of us. If they're going through something and we're unaware of it, it's something that doctors or nurses can pick up on. So I think that this is something that's crucial that we provide for our students and for our children, to make sure that they're insured so that they're never out of pocket that expense, or parents feel hopeless in the fact of providing good care for their children. Thank you.